Welcome back. This is the third video in a series about the most important win-win-win measures. So measures that have multiple benefits. In the previous two videos I spoke about veganism, that has benefits for the animals, for human health and for the environment. And I spoke about a green tax shift and basic income. So this has benefits for the environment again, for the workers, and for the economic system, poverty and so on. Now in this third video I want to discuss a third measure that has multiple benefits, and that is family planning, voluntary family planning, or sexual and reproductive health. So the problem is that each year about 80 million women get an unwanted or unplanned pregnancy. So these women, they do not want to get pregnant this year, but they do not have proper access to facilities to prevent pregnancies. They do not have proper access to contraceptives, for example. So there are organizations that invest in high quality contraceptives, distribute contraceptives to women in poor countries. Everyone is entitled to the access of these cheap, high qualitative contraceptives, correct information, education, and services for reproductive health in order to prevent the unwanted pregnancies. So investing in reproductive health creates a fair condition for voluntary pregnancy reduction without coercion and paternalism. So the measures that I propose here, family planning, it has nothing to do with any kind of coercion. Now this family planning has multiple benefits. If you do the calculation based on studies from, for example, the United Nations Population Fund, the UNFPA, and the Guttmacher Institute, we can calculate that if you invest €1,000 in family planning, that will prevent about 17 unwanted pregnancies. 17. That adds up as about 8 abortions avoided, of which 5 are unsafe, of which 2 have abortions with complications. Next, 2 miscarriages, and second, 7 unplanned births. So these add up to about 17 avoided unwanted pregnancies. Also, you avoid 0.3 infant deaths at birth, 0.02 maternal deaths, and 0.03 children becoming orphans. So you see, with €1,000, you can do a lot of good in terms of avoiding these unwanted pregnancies. You can also look at how many healthy life years, quality adjusted life years as they speak, you can save for mothers and the children in the families that are already born by providing good means for family planning. So €1,000 investment in family planning results in saving 12 healthy life years. So that's very cost effective. 12 healthy life years per €1,000. And this makes contraception one of the most cost-effective methods to save healthy life years in developed countries, after other important interventions such as prevention of malaria through distribution of mosquito nets, bed nets, tuberculosis treatment, deworming, and things like that. So on average we can say that for every euro invested in contraception, about 1.4 euros of medical costs will be saved. So the cost-benefit ratio is very positive. And some studies say it has a very, very high cost-benefit ratio. So the benefits are much higher than the cost. Why are these? What are the multiple benefits? Well, first of all, if you look at the veganism and this tax shift that we spoke about in the previous videos, with veganism, there was the idea of a basic right, the right of bodily autonomy of animals. With this tax shift, a shift away from taxation on labor, we could speak about a basic right of bodily autonomy of the workers. and the workers are the vulnerable group. They can be exploited, their work can be exploited. Now, here also in this third measure we have a vulnerable group, the women, and the women also, they have a right to bodily autonomy. The body of women belong to the women, and so the women themselves can decide what happens to their bodies. And that's the idea. If with an unwanted pregnancy, it means that their bodies are used against their will. So that's a violation of this right of bodily autonomy. So that's the first, from a right-based perspective, a first reason why family planning is important. Next, we can look at the welfare ethic. So the well-being. Again, the well-being of women involved. We speak about physical health. So family planning leads to less risky abortions and less maternal mortality. An unwanted pregnancy or an abortion is always a risk for women in poor countries. So a higher risk of fistula, for example, bleeding, infertility and infections. And the rapid succession of pregnancies increases maternal mortality. So about 35% of deaths of women during childbirth could be avoided by preventing unwanted pregnancies. So that's how you can save a lot of lives, healthy life years, by preventing maternal mortality. Also related to the mental health issue of women and family members, unwanted pregnancies often take heavy toll on the emotional well-being of women and their families. Women who become unintentionally pregnant have a higher risk of depression during and after pregnancy. And for example, they smoke more and eat more unhealthy foods. Education of women, unwanted teenage pregnancies, of course, prevents the education and economic opportunities of those women. Then we can look at the children that are already born in the families, the physical health of the children. A rapid succession of births are not good for the other children and the babies that are already in the families. And so about 1 million babies could be saved every year if the successive pregnancies of a woman are spread with at least 2 years. Children born from unwanted pregnancies often have lower birth weights and more birth defects. Also, mental health problems of the children of unwanted pregnancies often have emotional difficulties, poor school results, behavioral problems that lead to more delinquent behavior. And the quality of the parent-child relationship is lower when the pregnancy was unwanted, and the children are at higher risk of neglect and abuse. Also, the education of the other children. Excessive numbers of children in families puts great pressures on educational facilities. In small families, children can receive more parental attention, which enhances their quality of education. Next, you have the nutrition of the children, of course. If you have small families, the children are well fed. Then there is the health risk of the partners. So some forms of contraception, such as condoms, of course, they reduce the risk of sexually transmitted diseases, HIV, AIDS. So that's a health benefit. In general, looking at the broad population, poor people with a high birth rate, population growth can be higher than economic growth, and that means that the income per capita decreases. And that can cause a downward spiral because poorer populations have worse access to reproductive health facilities. So investing in family planning can break this negative spiral. So in terms of poverty reduction and emergency aids, without investment in family planning, this is often swimming up against the stream, because population growth can aggravate the problem of hunger. You can also look at, for example, social security, peace, for example. A lot of unwanted births generate a youth bulge. So with a lot of young people, and violence is usually caused by young people, mostly men and boys. So a youth bulge, a large young population of young adults, men, is one of the demographic stress factors that increases the risk of violent conflicts. So that means a decline in the annual birth rate of 5 births per thousand corresponds with a 5% decrease in probability of a civil conflict in the next 10 years. That has been studied by, for example, Pentagon, military organizations. So these are benefits for public health, poverty relief, social security, things like that. And finally, the third pillar are, of course, the environmental benefits. So we know that most humans have a very high environmental footprint, an impact on biodiversity, on ecosystem health. And of course, with a lot of unwanted pregnancies, there will be a lot of unintended births, a lot of new people on this planet. And those new people can have a big impact, especially if those new people, again, in the future will reproduce and have more people. So the increasing use of natural resources and the increasing pollution due to activities of an increasing number of humans threatens biodiversity and ecosystems. Through investments in family planning, the population will stabilize and the global average fertility rate may soon fall below 2.1 births per woman. So we see due to history and through history, the past few decades, the fertility rate, the number of children per woman, is decreasing from 6 children to now about a bit more than 2 children per woman. And so it will move towards this replacement rate, 2.1 births per woman. It's a replacement rate that means at the end you will reach a steady state population. Increasing the funds for family planning can reduce world population in 2100 to 7 billion people instead of, for example, 12 billion people. And that also means that investment in family planning is a very cost-effective way for example, CO2 compensation to reduce global CO2 emissions. Because the future newborn children, they will have a long life, and during this life, when they generate wealth, they will emit CO2. So if you avoid these unwanted pregnancies, you avoid the unintended births, you avoid those lives. You can do the calculation, and then you can say that it takes about 6 to 12 euros investment in family planning to avoid 1 ton of CO2. So compare it again with the numbers I gave before. This investment of 1,000 euros in family planning, it resulted in 12 healthy life years of mothers and newborn children. You avoid 17 unwanted pregnancies, but you also avoid the emission of 100 tons of CO2. That's the equivalent of the yearly emission of 5 people in a rich Western country such as Belgium. So it is a very cost-effective means to reduce global CO2 emissions, this investment in family planning. And that means family planning is an ideal win-win-win situation. So this finishes the third win-win-win situation. Again, those win-win-win situations are unique in the sense that they have multiple benefits. You can say, well, these stories are too good to be true. How is it possible that they have so many benefits? But if you look at it, all the measures that we can take, statistically speaking, some of the measures, a minority of them, will have multiple benefits. So that's what I did. I looked for those measures that have multiple benefits, and I find basically 3 of them. Vegan lifestyle, a green tax shift combined with basic income, and investment in family planning. Okay, see you next time.